It's 6 a.m. in New York City, and Luigi Mangione is standing in a dark alleyway waiting for his target. From the Hilton Hotel on 54th Street, out walks Brian Thompson, the CEO of one of the biggest insurance companies in the United States. Luigi takes the shot, and the bullet hits Brian's back. He was immediately rushed to the hospital, but he didn't survive. Until this time, no one knows the motive of the crime. But later, when investigators extracted the bullet from Brian's body, things got interesting, because engraved on the bullets are the words deny, defend, depose. These words were a reference to how insurance companies refuse to pay out health insurance claims, prioritizing profits over the lives of their customers.
Deny, defend, depose. That was engraved in the shell casings that were found in New York City, where that CEO was basically hunted down.
Like many others, Luigi was not happy with the healthcare insurance system in the USA. It's expensive, insurance companies don't pay out, and US citizens are dying because of it.
Mom died from complications due to diabetes. Diabetes requires a lot of supply. All of the things that she had been prescribed and insured for the last 10, 15 years of her life were no longer going to be covered. The morning after my mom died, a box full of all of my mom's supplies for the next 4-6 months showed up on my front step. And inside the box, with all of her supplies, there was a letter that said, "Due to the change in your current situation, we have now fully insured and covered your supplies." The current change in situation was listed as death. So yeah, it makes sense that all of the health insurance companies in the United States have now taken their CEOs off their websites, because it's not a matter of if this happens next, it's when.
But this problem has a solution, and it's not a secret. In fact, many countries are doing it, and it's working great for them.
Welcome to the first edition of the Australian Health Journal.
So even though the US government knows the solution, why do they refuse to implement it? The answer to this question starts with a group of teachers in Texas. So back in the 1920s, Texan teachers couldn't afford to pay their medical bills, and as a result, people got sick and even died. So Baylor Hospital, the only hospital in Texas at the time, came up with this revolutionary idea. They offered a plan to local teachers, where for just a small amount each month, they could have their hospital visits covered. It was like a prepaid phone plan, but for your health. They called this idea the Baylor Plan, and it was a total game changer. It caught on like wildfire, and soon hospitals all over the country were offering similar plans.
Baylor Medical Center at Garland. Any closer and it would be a house call.
But there was a catch. These early plans mainly focused on covering big stuff like surgeries and hospital stays. But everyday things like checkups with your doctor, not so much. Then came World War II, and things got even more interesting. People didn't want to work, but companies still needed workers. So they needed a way to attract new employees, and guess what they landed on? The Baylor Plan, which by now had been renamed health insurance. Companies started offering health benefits as a way to lure in the best employees. At first, everyone thought it was an amazing idea, but it actually ended up creating a link between health insurance and employment. And this link causes major problems today, because it means when you have a job, you're safe, because you have health insurance. But if you get fired tomorrow and the next day you get sick, you might end up with a huge hospital bill because you no longer have health insurance. And that, my friend, is a problem that continues to plague the American healthcare system, and it's only getting worse. Okay, let's talk about money. Have you ever wondered why in the US a trip to the ER for something like a sprained ankle can cost more than a new iPhone? Well, to understand this, we need to follow the money trail. Remember how those early health insurance plans were mostly offered by hospitals themselves? Well, things started to change when private insurance companies entered the picture. Suddenly, instead of one simple plan, there were tons of different options, each with its own set of rules, coverage limits, and costs. It's like trying to choose a cell phone plan. Overwhelming. This created a super complicated system where hospitals and doctors negotiated on prices with individual insurance companies. Think of it like this. The hospital might charge $5 for an aspirin if you don't have insurance. But if you have insurance, they might bill the insurance company $50 and just pocket the difference. This became a billion-dollar industry, and because of the money and the greed, the focus shifted away from keeping people healthy to instead maximizing profits. And as a result, healthcare costs skyrocketed, and hundreds of thousands of people could no longer afford healthcare. To find the solution to America's healthcare crisis, we have to look at a country on the other side of the globe, Australia. Australia uses what's called a universal healthcare coverage. Basically, this means that everyone has access to essential healthcare, whether they're rich or poor, employed or unemployed. But wait a second, this must be expensive, right? Well, yes, and also no. Australian citizens pay some of the highest taxes in the world, as much as 45% in the highest tax bracket, compared to the US's 37%. And the government of Australia takes this tax money and pays for the health insurance of every single citizen. That's 26 million health insurance policies for all 26 million Australians. This is what's called a single payer system, basically meaning that the government is the one who pays for everyone's health insurance. This simplified things big time. So if you're sick in Australia, you go to any public hospital and you're treated 100% for free. And the result? Everyone has access to affordable healthcare, from regular checkups to even major surgeries. So if a single payer system is so great, why hasn't the US done it already? Well, it turns out there are some serious roadblocks in the way. First off, there's the political challenge. The idea of a single payer system has been around for decades, but powerful players like insurance companies and pharmaceutical companies don't want it to become big in the US, because if the system changes, they're set to lose billions of dollars. So instead, they spend their money lobbying to make sure that it never happens. Then there's the issue of public opinion. Some people worry that a single payer system would mean lower quality healthcare, like longer queues at hospitals or less qualified doctors, while some others argue that the government is inefficient and shouldn't be playing a big role in healthcare in the first place. And finally, there's the cost. Implementing a single payer system is pretty damn expensive, and guess who's paying? US citizens. This means the government would have to increase tax rates by a significant amount in order to be able to afford this new healthcare system. And as a politician, this can be a hard sell to convince the people whilst also winning the election. If this video made your brain bigger by even 1%, subscribe to this channel for more in-depth videos that will make you the smartest person in any room.